brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living Tuesday. Heart disease is the leading cause of death in men and women. In fact, the American Heart Association estimates more than 64 million Americans have one or more forms of cardiovascular disease. Here to provide some helpful hints to have a healthy heart is Express Care's Dr. Jitka Lom, my good friend. Hi, Doc. How are you doing?
Hi. Nice to see you.
Very apropos that we're talking about the heart because, of course, St. Valentine's Day is coming up. And, you know, the heart is so emblematic of so many things emotionally, but, of course, in terms of the physiological effects and everything like that, obviously it is the core organ and everything like that. But what particularly about heart health affects people here on Guam the most?
Well, you know, heart disease is congestive heart failure and coronary artery disease. So, Jason, you have little arteries, little blood vessels that feed your heart muscle. And over time, these can become diseased and clogged. So you hear about clogged arteries, and they don't supply the blood that your heart muscle needs. Then your heart muscle, which is really a pump, doesn't function as well. And you can have things happen to you like heart attacks and basically pump failure, which is congestive heart failure. And these are reversible, or some of the risk factors for this anyway are reversible.
And now one of the things, of course, like so many different types of medical ailments is a patient or a person can, you know, take good care of themselves and, you know, they can lead a healthy lifestyle and everything, but there is that risk they run of hereditary conditions and everything. So talk about that.
Yeah, exactly. So this does run in families, and it does run in families on Guam especially. And so you have 6 risk factors for heart disease. One is being a man, one is family history, and then you have diabetes, high blood pressure, obesity, I already mentioned high blood pressure, high cholesterol, and smoking. So these are the things that you can work on to reduce your risk. You can't do much about your family history, but you can stop smoking, you can reduce your cholesterol, you can manage or reduce your risk of diabetes and your cholesterol level. And
of course you said being a man, so by virtue of the fact that I am male, I stand a higher chance of developing cardiovascular disease than you are as a woman and everything. Why is that? What role does gender play?
It does play a role. Estrogen tends to be a protective hormone for women up until menopause. After menopause, of course, it's not protective anymore. But during those early years, we have that advantage of protection. So that's the main difference.
Okay. Now, is there a link between heart health and oral health?
There is. People that have cavities, a lot of dental periodontal disease or gum disease, they will tend to have ongoing inflammation in their body. So independent of any other risk factors, meaning like smoking or heart disease or cholesterol or anything else, they will have a higher chance of having heart disease, especially heart attacks or strokes.
That's interesting because I read something about that, and certain people, they say, oh, that's just a myth, or that's, you know, your dentist trying to upsell you on, you know, on different types of cleaning, so, you know, they can, you know, have a better Christmas for themselves. But there is actual fact that supports that.
No, there is. In fact, some of the bacteria that are identified in the oral cavity have been identified in the heart arteries. So they find the same germs that are in your mouth in your heart arteries. So you need to take care of your mouth. Okay,
fascinating. Now we have talked about hypertension here on Healthy Living Tuesday before. Relative to the heart, what role does that play, and how prevalent is it here in our island community?
It's very prevalent. High blood pressure strains your heart. Basically, your heart is a pump that's pumping blood all the way around your body. If there's a lot of body, meaning you're very obese or heavy, the heart has to work harder. That is one reason for high blood pressure. And another is some people just have very tight arteries, you know, so the heart is pushing very hard against resistance, and because that's a hereditary factor. And for that reason, the heart will have to work very hard, get tired, and fail. So that's the reason high blood pressure is a risk.
How about for those people who say, you know, like, oh, my heart races often, and, you know, either because they've got a crush on somebody, or because they're very, very stressed out, or just because, you know, like they're really an emotional person and everything like that. You know, you've said before on this very program that, you know, it's important to keep your emotions in check and try and, you know, have an even keel and everything like that.
It's true.
But how, so that actually has merit.
That's true. So what you're mentioning is palpitations, when people feel their heart flutter or they can feel their heart beating. Normally when we're just sitting here talking, you don't feel your heart beating. It's not something you think about. But if it comes to your awareness, then there's often something wrong, and an irregular rhythm. And it's one of the causes of death too, sudden death due to an irregular heartbeat that people can develop because of coronary artery disease. But back to the emotions, it's a proven fact that Monday mornings are a time for more heart attacks in the general population because that's when their stress levels go up. You know, they go to work, get stressed out, and also anger. Anger attacks, you know, fury and rage is very unhealthy for your heart. And of course unhealthy for you in general, but for your heart, you're more prone to having heart attack and stroke if you maintain anger.
That's very fascinating. Well, I can tell you, I can't speak for everybody, but Tuesdays are one of my favorite days because, of course, it's a chance to interact with you.
Thank you.
And we will continue to do so. We've got our viewer questions coming up, so sit tight.
Thanks.
And you out there in TV land, stay with us because the good doctor will answer your questions that you sent us on Facebook when Healthy Living Tuesday returns right here on Extra.